70 to 80% of medical decisions today are guided by clinical laboratory data as compared to only 10 to 15% about half a decade ago. This has increased the involvement of laboratory testing in a patient's clinical journey and has positioned laboratories as a specialty which most commonly and impactfully affects patient care.
Observed every year in April, Medical Laboratory Professional Week is an annual celebration that celebrates laboratory professionals and pathologists who play a vital role in healthcare.
Every day I get to see new cases, learn new things, and then deliver adequate diagnostic help.
My favorite part is to make appropriate diagnosis, which can help clinician to take appropriate decisions.
I really like or become very passionate whenever when I find abnormalities, and that is going to help the patient.
My most favorite part of being a laboratory professional is that I know I am the backbone of every diagnosis that the clinician makes. Though the patient never sees me, never talks to me, or never hears me, but the entire treatment of the patient is based on a report which is issued by the laboratory.
We reach to the reports which creates a different diagnosis what doctors was expecting. So this add on the treatment, or it helps in to change the treatment, and which gives the better outcome, and that definitely helps the patient to get treated early.
So for screening, I deliver early diagnosis so that the patient can undergo further treatment. And for the known cases, I deal with staging and the further whatever therapeutic help the patient needs. So it is a help for the clinician.
It makes a huge difference, as a right diagnosis will help clinician to make right treatment, while a wrong diagnosis will cause delay or wrong treatment.
My work in patient care is really important, because what we are doing is we are trying to diagnose some abnormalities behind the microscope, and this kind of abnormalities, when detected in lab, they are going to make difference to the treatment of the patient, be it a cancer or some kind of a genetic disorder.
You should be dedicated, hardworking, because your work in lab is going to make a difference in the treatment of the patient and the benefit to the doctor also who is treating them. So it's a very dedicated job.
Whoever wants to pursue this career has to be a very responsible person and has to deal every case, every sample as a patient. Not just a sample. So it's just like a patient coming to a OPD.
I will advise that this is very noble profession, so we should improve our knowledge and skills to make change in other life patient.
So someone who wants to join this profession should be really passionate about working in the labs or diagnostic setup. If you have a passion, then only you can enjoy your work. If you are not interested or working in healthcare profession, so one should avoid, because here you need to give your 100%. You may have to work on your holidays, on your Sundays, just to help the patients.
Clinical laboratories play a crucial role in a patient's clinical journey, and laboratory professionals work tirelessly every day to help patients and make their lives better through prevention, screening, diagnosis, treatment, and monitoring. Let us all acknowledge the efforts of laboratarians and wish them a very happy Laboratory Professionals Week.
Lab saves lives.